If this video has found its way into your algorithm, there is a really good chance that you have problems with your vagus nerve. Upper cervical care is dealing with the atlas. This is your very top neck bone, and the reason that this is so important to the vagus nerve is because this is an above-down view of the atlas. So here would be your head. If we were looking at the very top of your head, this is looking straight down through the spinal canal. So the reason that the atlas will affect your vagus nerve is because if the atlas generally misaligns in different directions. It can misalign forward, right, left, backwards, left, and right. Just the shape of which those articulations, those joints are designed, they can generally move in one of those four directions. So if the atlas specifically misaligns forward in an anterior position, it can affect this space right here. So this space is called the carotid area or the carotid sheath. Within this space right here is your carotid artery, your internal jugular, which is the vein where all the blood flow comes out of the head. And around this sheath also lives the vagus nerve. So if there's a problem because there's a compression, so the atlas has shifted forwards, now this space is being occupied by the atlas. Instead of having space for that vagus nerve, it becomes compressed. This problem can then be accentuated if you have calcification of your stylohyoid ligaments. We all have these ligaments that come from deep inside of our head, about 1.5 inches in from the outside here. You can't feel it. And then this ligament then comes down and attaches to your hyoid, which is a small bone in the front of our throat. Doesn't articulate, doesn't have any joint with any other bone in our body, but it's where a lot of the muscles attach onto the front of the mouth. So if there's calcification of that stylohyoid, now we have a bony structure in the front of the vagus nerve. We have the bony structure of the atlas, and we have this little space in between. If the atlas shifts and misaligns forward, even just a millimeter or two, that can then compress onto that jugular or the carotid sheath, which is going to then affect the function of your vagus nerve. Vagus nerve issues include digestive problems, syncope. So vasovagal syncope is where you'll faint, or they call it pre-syncope, which is where you don't completely faint. You've had this feeling many times where you're about to faint, but then you just need to get down, get your head down, lay down. That vagus nerve is not functioning properly. It can also show up as headaches, migraines, dizziness, digestive problems, anxiety. So a lot of different things can fall into this vagus nerve, and the atlas correction, so what we can do is now we move that back, we open up this space again, remove that pressure off the vagus nerve, and it starts to function more properly. There's no bending, no twisting, no popping. This is all very, very gentle, working with millimeters. And we will be able to use a 3D scan of your upper neck to determine if you have this problem or not. So we can use a scan, the three-dimensional view, to see how is your atlas, is it in alignment, is there compression in this area, or is there plenty of room? So if you have problems with your vagus nerve, then you need to get evaluated by an upper cervical chiropractor.